Hello all, today we will be discussing health of healthcare workers and care for them and the importance of healthcare workers in our society. As we all know, our healthcare system is developing slowly, but similarly our healthcare workers also need help and support. They face a lot of challenges like mental, physical, social pressure, etc. Due to this, their life becomes very constricted because they live in an environment which is full of negative vibes. They go through occupational hazards, risk factors, etc. So, we should promote some strategies for our healthcare workers to support them. You can go through the slides to understand the key points for healthcare workers. The medical students also come under this sector as well, and also they form the future for the same. So what can we do to implement a good healthcare system for our own healthcare workers? Well, there's no issue. Our Indian government is supporting the healthcare system from COVID times to before as well. In Goa as well, Government of Goa has attained a policy for health for all in the year 2000. There are many hospitals, beds, clinics which have been increased since then. So, there was an interview which I conducted. It was an interview done at pathology labs. Thank you.
The COVID-19 pandemic has been brutal to deal with, and it has placed a lot of pressure on our healthcare sector. Healthcare workers are individuals whose responsibility is to safeguard and enhance their society's well-being. Together, all these medical practitioners bring up the world healthcare sector with all their diversity. The first line of security in combating the COVID-19 pandemic was ward staff, ward administrators, secretaries, ANMs at wards level, primary health centers, medical officials, technicians, and paramedics. COVID-19 also made several healthcare workers uncertain of their organizational system and worried that their workplace needs teamwork. However, with the right solution, leaders will re-establish confidence and reinforce the kind of collaborative spirit that allows an organization to work smoothly and have the best possible patient treatment. It doesn't seem easy to imagine that there is so much to be grateful for this Thanksgiving. Many citizens have had a tough year because of the worldwide pandemic which has been affected billions of human livelihoods, infected millions of people and killed more than 1 million. Giving thanks, however, has a particular significance this year for many Indians who were on the front lines of the pandemic or who were sick and healed. These primary health centers or PHC refers to essential health care are staffed by young medical officers who have recently graduated. The coordination, financial and groundwork are handled by a group of young ward volunteers and ward secretaries in their early to mid-20s. Since the first lockdown in March 2020, these young people have been at the front line of the fight against the pandemic, putting their well-being and safety first. During the COVID-19 pandemic, healthcare professionals have been champions, but they aren't recognized for it. Nurses have been underappreciated for a long time. Whether other members of their health services undergo the vaccination before them, frontline staff are shocked. Unfortunately, certain people's faith in their organization represents couldn't be shaken due to this. Modern healthcare. This is a fascinating subject because it is one of the most important subjects where we have seen the tales and witnessed their never-ending attempts. It is also looked into how health services can kind of restoration coordination, mainly if they have any mistakes throughout the pandemic. According to a study of more than 2,300 doctors conducted by Modern Healthcare in September 2020, 40% of physicians claimed that their health system aided their emotional well-being during the pandemic, but 73% believe that their peers were the most supportive internet outlets. Another statistic is that 78% of healthcare staff believe COVID-19 would have a very negative or extremely negative impact on their workplace only 1 month after the outbreak began. In 2021, 81% of 9,200 nurses continue to use the single-use products such as masks and gowns. According to a survey, 1,083 infection preventionists conducted by Modern Healthcare, almost 30% of them reported that the company had no gloves on hand. As a result, specific teams could experience a shortage of resources as a result of these factors. As COVID-19 pandemic hit India, there were issues raised about the safety, where there were imposition of masks, gloves to sanitizers. The violence against medical staff was still pertaining, at a higher risk. The medical staff had to step out, wear their PPE kits and move on. They had to even work until the best of times, stay isolated, come home, completely disinfect themselves to prevent further transmission. Janta curfew was observed, called by the PM to salute the leaders. They had issues which were not just related to health but mental, social and physical well-being. They had to step out into the streets, move from door to door to check the temperatures of the patient. Also, the cremation of dead bodies were at times carried out by the professionals only. With no proper food, lack of sleep, harassment and emotional disturbance made them question about their families and their own lives. But still, India proved to overcome this virus by making a vaccine. This is how competent Indian healthcare system can be. Thank you.